Happy Monday morning, everybody. Welcome to a special Monday edition of Solidarity Live. Hi, Alex. How are you?
Hello, Jocelyn. Well, it's Monday. It's different doing the show on a Monday. We can kick off the week instead of ending the week. Let's call this our Juneteenth episode, because the reason we didn't do it on Friday is a brand new holiday that the federal government recognized the day before it happened, Juneteenth. At We Act Radio, we've long called for the celebrating of Juneteenth. So I was happy to push the show to Monday. It's a really great show. We have just an incredible activist and warrior for health justice joining us to talk about truly big news. I don't want to overplay because they're going to keep trying to rip healthcare away from people forever, they being Republicans and the plutocrats. But last week, the Supreme Court found 7-2 in a 7-2 decision again that Obamacare is the law of the land. And that's the third time. So possibly they're not going to try to bring it up. And this is like the most conservative court that has existed since, pre-New Deal. And they found that Obamacare is the law of the land. So joining us to talk about that, Laura Packard, the founder of Healthcare Voices. And I can ask Laura the question, do you think they're going to take another run at it? But I actually will just sort of hand over the mic to you to just sort of tell us what happened, because I know it's just your key part of the fight.
Okay, well, on Thursday, the Supreme Court released a decision that we have been waiting for a while. This court case, which threatened the entire Affordable Care Act, has been working its way through the courts for years. And so the Supreme Court finally released their ruling, and surprisingly, it wasn't terrible. They dismissed the case on a technicality, and the verdict was 7-2. They decided that the people who sued didn't have standing, so they weren't, the plaintiffs that put forth a case didn't have the legal right to make a case. So they didn't rule on the legal issues itself. They dodged the whole thing, but the way that they did it indicated that this court is tired of these Affordable Care Act court cases. But that does not mean that the people bringing these cases are done, because it's even a plank in the Republican Party's platform to destroy the Affordable Care Act. So I don't see the demagogues in the Republican Party dropping their attacks on the Affordable Care Act anytime soon.
Now, just on the lack of standing, it is noteworthy, though, because the plaintiff was Texas, right? Mm-hmm. Yeah. So if Texas doesn't have standing as a state that doesn't want the Affordable Care, that's a big deal, because that definitely says these other, they're going to have to find another route in. So yes, I'm not trying to be overly optimistic here. I'm trying to mainly that they have closed a door, I think, with this ruling. It's sort of like, if this court isn't going to give you what you want, and this court was like designed in a lab to give you what you want, you're probably going to have to go about destroying Obamacare and ripping people's health care away through another avenue, through a legislative process or something else. I too agree. The plutocrats can't stop trying to keep people, take their health care away. They make money from it. They extract money. I know you've seen this, but it always surprises me just how big the effects are. When you give people healthcare in this country, it affects the GDP because so much of our GDP is actually financialized health. So when you give people healthcare as a right, guarantee it, or you lower drug prices for people, it has a negative effect in some way because the plutocrats aren't able to extract as much money from the people. That's the problem with having a financialized healthcare system, is that we're seen as centers of profit, not as human beings who deserve healthcare. Where do you see the fight going next, Laura?
Well, they're not done. And in fact, there are court cases now. I believe there's a court case before the same judge that originally ruled on the Affordable Care Act. And this court case is about the essential health benefits that are a part of the Affordable Care Act. So threatening those. So the attacks will continue. And but there's also new opportunities because we've seen just an article that came out this morning saying that Congress is talking about expanding Medicare to cover dental, vision, hearing. There's also conversations, as you know, Alex, about lowering the cost of prescription drugs as a part of President Biden's infrastructure bills. And there's conversations about what to do to fill the Medicaid gap. The over 2 million Americans right now that don't make enough money to be able to afford insurance through the Affordable Care Act, but their conservative states refuse to expand Medicaid to cover them. So there's 2.2 million people that can't afford health care, and they are in states like Florida and Georgia and North Carolina and Texas.
Yeah. How many? I should let Jocelyn talk. Sorry, Jocelyn.
Oh, am I allowed to talk? Is that I actually was going to take us kind of in a different direction. Laura, do you mind sharing what got you into all this? Because I know this has been a very personal fight for you for a while.
Yes. So the AFL-CIO sent me to Arkansas over a decade ago now to help get the Affordable Care Act passed in the first place. So 2009, 2010, I was in Arkansas working with people that had the most heartbreaking healthcare stories. And I had no idea that I was eventually going to be one of them. 4 years ago, I walked into a doctor's office with a nagging cough and walked out with a stage 4 cancer diagnosis. But because of my insurance through the Affordable Care Act, I was able to afford the 6 months of chemotherapy and the month of radiation I needed to be in remission today. So it would have bankrupted me, or I might not even be here today if I still had the junk insurance policy I had before the ACA.
Yeah, that's terrifying. That's really terrifying. What was it like to be fighting for that, for both of these battles at the same time?
Well, the day after my first chemotherapy appointment, I was on the couch, struggling through the side effects. And that's when Republicans in the U.S. House voted to dismantle the Affordable Care Act, which was keeping me alive. So obviously that was a very stressful time, because not only did I have to fight through all the cancer treatments, but every day reading more terrible news about what was going to happen to the insurance that I needed to pay for it.
Well, thank you for doing it. I mean, that's kind of an understatement, but I think it's yeah, I can't imagine. And it's really weird that this is something that we're even having to have a conversation about. Is I think that always comes up whenever we discuss healthcare justice on the show or anywhere. It's sort of a surreal thing that we're saying you shouldn't have to have exorbitant amounts of money to access basic health insurance.
Exactly. We're the only industrialized nation that hasn't figured this out. And there are many different ways to do it. I mean, there's the UK system and the Canada system and France and Germany. And, everybody's got a slightly different way, but they've all got a better system than we do.
Every single one of them has a better system than we do. Our system is uniquely terrible. And then the right wings are like, well, then why do they fly here to get treatment? And you're like, because we have a system that works super well if you're really rich. We have a great healthcare system for rich people. If you're rich in this country, you can get some of the best care in the world. But for everyone else, literally everyone who's not rich, and sometimes when accidental stuff happens to rich people too, and they find themselves in the not rich healthcare system, it's terrible. It's a system that profits off of not providing care. An insurance company can only make money by taking our premiums and denying care. There's no other business model. They come up with like lots of words to do that, but that's it. They take our premiums and deny our care. And
if we value private insurance companies, there's even a way to make that work. If you look at France and some other European countries, they have private insurance companies. It's just those insurance companies are not for profit. Yes. Because when an insurance company needs to make a profit, that's when they start cutting back on actually covering people's care.
Japan has a really something that you could do. I actually personally, and we can talk about that. I don't think you can get from here to Japan or to France or to Germany because our health insurers here are so toxic that they, and our laws around like what is a nonprofit, they would just bend the whole. There's so much money for them to bend the whole system to their will, that I think that just replacing them as a payer is the easiest way to go, right? The NHS is a government system in the UK. That's not what we talk about when we push for Medicare for all. All we're saying is just the payer, the person who pays the providers, just get rid of them as private companies and have it be an improved, expanded traditional Medicare. That's what people over the age of 65 have. There's just a payer. It's not, the government is nowhere in the provision of healthcare. They're just on the billing side. And then, you don't get all of these. I can speak from my personal experience on one thing. When you have a kid, every parent in this country knows that it's just literally the start of random medical bills forever. You just get constant medical bills, and they're like, oh yeah, 180 days ago, only this part of that lab process was covered. And you're like, what? So it's just nickel and diming us forever. That's what they do. And, it's all gobbledygook. They're like, oh yeah, you're covered, but you're deductible and you're out of pocket. Yeah, you owe us $10 every month forever. On top of the fact that our insurance is the price of a shiny new car every single year. And it comes out of our wages. We know that. So, any system, and we could argue whether, we could actually mush United Healthcare into a non-sociopathic box, and be like, don't be evil. But I don't truly believe we can. But any system marching along the way is better. For example, covering that Medicaid gap. We're going to probably do that in the private side. It'll probably be through subsidies through the exchange. That's great, though, because people are going to have some health care, right? Millions of people are going to have health care. So I never will fight against that. Anything that's walking us towards a point where we're not, you get sick, you go to the doctor, you get the care that you need. That's the system. And other countries, including Taiwan, it's a smaller country, but that was very recently, actually just switched their entire system. So it's very possible to do. And the only thing that's missing is political will because we have this arsonist party, the Republicans, who keep pushing this stuff. I mean, 11 years, Laura, they've been doing this. 11 years. Their fundamental, like reason d'etre is to take people's health care away. Can you just expound on the evilness of that for a bit?
Sure. And also, we can talk some more later about advances such as a public option that just got passed here in Colorado and in Nevada. So there's good stuff to talk about, too. It's not all the bad stuff. But yes, the Republican Party, Republican elected officials have made it their mission to dismantle the Affordable Care Act. And so not only have there been these lawsuits, this is the third lawsuit to hit the Supreme Court, and each time the Supreme Court turns it away. But also there have been regulations, and there have been governors in the states that have chipped away where they can. And of course, there was President Trump that pushed junk insurance plans. He loosened the rules so that insurance companies could sell junk to consumers who would only realize it when they actually tried to use it. And the Trump administration did things like allow Georgia to opt out of using healthcare.gov so that only insurance brokers would sell policies. And of course, an insurance broker is going to want to sell the thing that makes them the most profit, which isn't necessarily an ACA policy. So they were stripping away all these protections that consumers rely on because it made more money for certain people. And one of the reasons why they're so determined to strip away the Affordable Care Act itself, not only is because it's called colloquially Obamacare, which Obama is is a terror figure in conservative circles, but also because how the Affordable Care Act is paid for is by taxes on rich people and corporations. So if you remove the ACA, you give your donors a big fat tax break.
That's terrifying. I mean, it goes without saying, but I think that, Alex, thank you for using the words evil, because that is what it is.
I thought you were going to say thank you for saying reason d'etre, because
actually, I enjoyed that too. Your French is a lot better than mine, though, so I'm also a little intimidated. But Laura, we both love France. Do you love France? Not just for the healthcare.
I love brie. I love baguettes. What's not to love?
Yeah,
I mean, it's a Francophile show right now. But so, okay, wait, so there are positive things? You mentioned some positive things. Should we pivot, or should we keep talking about evil? Because I like positive things.
Let's talk about some good things. So first of all, there has been action on prescription drug costs in the states. Colorado, my state, is one of them that just passed a law for a prescription drug affordability board to control the prices, the outrageous prices that people are paying. There's also been a lot of work on insulin, in particular, insulin affordability bills in Nevada, Colorado, and elsewhere. So we're seeing more action on the state level for regulating drug prices than federally, although it remains to be seen whether Congress goes for it or not, because they need to find some money somewhere for some of these infrastructure bills. And that is a big savings place if they have the will to go for it.
They are going for it. We should talk about it because we both work on that too. I mean, they're going for it. They're trying to pass HR 3 in the House, which is the big drug price negotiation bill. And in the Senate, they're trying to pass some version of a Senate drug price bill, which I think is important. I love the state efforts, but you and I both know that the pharmaceutical industry is so powerful that they can literally crush state efforts. Even big states have a really hard time. They pass a law and then pharma just destroys it. We've seen that a few times. We saw that in Maryland. And when they do that, they are just consistently advancing the need for the federal action, because we have to take on these plutocrats. Pharma, the public is just totally there with us on this one. So it's such a layup. What are you seeing on that on the question. Do you think they're going to get it together?
Well, it's not a question of whether Americans want this, because they do. Prescription drug costs has been the top polling issue, or one of the top issues for years, and it only gets more expensive because the big pharma is more than happy to jack up their rates every year. So the people want this. The hard part is because so many elected officials are funded by big pharma, getting them to vote for it. But we have a shot. We have a chance. It is tough, because in a 50-50 Senate, I don't know if any Republicans will vote for this. Last year, there was a bipartisan bill, the Grassley-Doggett bill, that Grassley-Wyden rather, and it never came up for a vote, but that's because Mitch McConnell left it in the graveyard. Is there actually the will to do it this year with Republicans?
No.
Now that it's not for show, but it's really real?
There's no way the Republicans will vote for it. I'm sorry. It's just like the Grassley-Wyden was fake. It took every ounce of Grassley's political capital to get it out of committee. We go deep on policy stuff here, Laura, so our folks are pretty inoculated against the DC esoteric system. They got it out of finance under the Republican Senate, up to McConnell saying, absolutely, this is not going forward. And there was never enough votes to actually, right? Like, the bipartisanship was bipartisan with 3 Republicans. And 2 of those Republicans were only bipartisan because they wanted Grassley to like them, and they will never vote for it on the floor. I mean, like, maybe Cassidy from Louisiana, he's got a very weird bio. He used to do, he was a care provider, and he dealt with a lot of people with hep C. And so he saw kind of like the absolute pinnacle of pharma badness with the hep C drugs. But yeah, my read, Laura, is that I won't ever, it's a hard no. They will not, the Republicans won't. The only possibility is partisan. Drug price negotiation has to be passed partisanly in the Senate, in the reconciliation package, alongside these Medicare expansions that you brought up earlier, which we just saw Chuck Schumer putting his vocal support on this morning. So I want to put it out there that the question to me is not, can we get Republicans to support it? Because the answer to that is hard no. The question to me is, can we get 50 Democratic senators or senators who vote with Democrats to support it? And that is my unknown. There's still a lot of question of whether we can get all of them. Can we get Menendez from New Jersey, who's very close to pharma? Hinkenlooper from your state, he's made noises before. There's a variety of them. Everyone knows Manchin and Sinema, but they don't generally make their bones on drug prices. Like, I actually don't think of them as that problematic there. But just to set the scene of, I don't like to be polite to the Republicans on this show, because I've met with them. I met with them during the Grassley-Wyden stuff, and it was really clear when you have those conversations. They were very honest. And Mitch McConnell still runs that caucus with an iron hand, and he is never wavered from where he is.
Mm-hmm. Yeah, so we'll see whether, I mean, this is such a golden opportunity to help people to do something that is good and is also good politically, because this is what people want. Whether regardless of your party, you're paying outrageous prices for drugs every month, and that has to change. So we'll see if the people beat the money this time. Here in Colorado, it was extremely hard to get the Colorado option passed, which the governor signed last month. I believe the statistics say that it was the most lobbied against bill in Colorado history. Just so much money poured into the state. I was getting postcards as well as all the TV ads and stuff. And they passed a bill that was not the same bill that was introduced. It went through the sausage factory and it came out very sausagey, but they were able to get through it. They signed a bill into law here and in Nevada. Conversely, in Connecticut, the insurance companies ganged up on the public option legislation there and killed it.
So that's terrifying. The most lobbied against? Really? I mean, why am I shocked still? What's wrong with me?
So let me put out, I don't know why you're shocked, but just this one might shock some people. In my career, I worked at Media Matters. It's generally been like economic justice, health justice. I worked in outreach HIV clinics. That's where I learned about policy and decided to come to DC to get my master's in policy to actually dismantle the pharmaceutical industry and build something based on justice. I went over to Media Matters and I was focused on something very different for a period, which was actually right-wing extremism. This is a decade ago. I built this team that was ringing the alarm bells about the white nationalists. What you see right now, you could see it back then, starting with Glenn Beck. We literally exposed Nazis. And we got one very valid death threat to my entire team, and law enforcement said that we had to take it seriously. And the reporter David Holthouse, who we've had on the show, had to move his family. But the reason I'm bringing this up is I got way more death threats, way more, when I worked on helping Obamacare pass, when I was fighting for the public option. Anytime Healthcare for America Now was mentioned on Fox News, it was just death threats all around. They'd fax us death threats. And, you reported ones that are real. They were also hilarious. They'd misspell communist all the time. And they'd leave us messages that just didn't even make sense. And our favorite thing to do was when one of them called, and, maybe not the death threats, because those ones you have to take seriously, but the ones where they're just yelling vile things at you, we would be like, oh, if you could just hold on for 1 second. And then we would transfer them to one of our friends. So it would show up on their phone as from Alex, and they'd pick up and it's some militia member being like, you're a communist trying to give us healthcare. But it is mind warping that literally trying to get people healthcare has been transformed through this propaganda network and just process into something bad. And I'm positive that the people who were yelling at us also were pissed off about their healthcare, right? I mean, that's the part that always got me, is how effective their propaganda is in making this an issue that it can't actually be about healthcare in their mind. It's about something else. They've transformed it into something else.
Right. Well, I mean, if you see people protesting, keep your government hands off my Medicare, or keep your government hands off my Social Security. Well, those are government programs. There's a disconnect there. Yeah.
I don't know exactly where. So tell us a little bit about the propaganda cannons in Colorado. What did the ads and how did they attack it? They didn't say you're going to get healthcare and that's bad, so vote against this thing that'll give you healthcare.
The providers, the hospitals, and some of the doctors or so on were very threatened by it because they felt like this would involve rate setting, and it would eventually involve cuts in how much they make. Now, Colorado Metro Denver hospitals have the highest profit margins in the country, so maybe their profiting should be taken a look at. But so one thing, there were a lot of doctors and groups of doctors that said, this means, the hospitals will go under or whatever. There's also there are specific pieces in the bill around equity and making sure that Black and Brown communities in Colorado get the same access to healthcare as other communities. And they tried to flip that around and saying that this was going to be an attack on people of color, that they would get substandard care and so on. So they threw a lot of stuff at the wall to see what would stick. And in the end, most of the industry groups at least got to neutral. So I think the Hospital Association got to neutral, and some of the provider organizations got to neutral. I don't think AHIP ever got to neutral. The insurance companies, I don't think they ever bought into it. But
did you have air support on the pro side, on your, or like on the, was there actual big money organizing on that side?
Medium money, small money.
Yeah.
It wasn't.
I said that meaning like, for our side, the justice side is never as big money as the plutocrat side, but air support for, I don't think air support is generally television and radio, and you got to just match it generally but it costs enormous amounts of money, so you need actually like a really organized entity to step up to provide air support.
And there was some, but it was not anywhere near matching. Healthier Colorado did some, CCHI, Colorado Consumer Health Initiative. I did some work with Be a Hero Action Fund, but it was very small compared to the amount of industry dollars. But, we had real people. We had real people on the news, writing letters to their local paper, calling their state legislators, and speaking at hearings and public events to explain why this is so important. And I mean, elected officials hear it all the time. Healthcare is too expensive, because healthcare is too expensive.
And, I mean, we talk about this on the show a lot. The reason things cost what they do is not some ethereal thing that just like happens. These are policy decisions. They're always policy decisions. And we can make better ones. The whole point of this, right?
And so the way that the Colorado fight went down, the bill was introduced in March. And so just millions upon millions of dollars, tons of lobbyists thrown at it. Colorado, it was just a hard fought thing. Nevada was watching. And so activists in Nevada went a different route. And so they worked on their bill quietly, and then they dropped it at the end of April, like a little bit over a month to go before the end of session. So they didn't do it months and months ahead of time. So they didn't have months and months of this industry advertising blanketing the state. So I think that is one of the reasons why the Nevada bill ended up passing more intact than the Colorado bill did.
Yeah, that is strategy, but you couldn't. I didn't follow it closely enough, but generally what you just said, I don't think Nevada could have done their thing if Colorado hadn't have done their thing. So it's the penguin problem. Someone has to go first. Penguin problem is a tech term, which I generally love, because it's all the penguins stand around the hole in the ice, and they go like this, and they know whichever penguin goes in first gets eat. And there's a sea lion under there that eats the penguin.
Is this a real thing?
Yeah, you can Google it, and you can Google the penguin problem. And the point is, whoever goes first gets eaten by the sea lion, and then all the other penguins can go in and they eat. And if no one goes first, the penguins don't eat and they all die. So it is an interesting thing, and somebody has to go first. It's
super macabre. I didn't know that about penguins.
Yeah, if you Google the penguin problem, you'll find it quite easily. Penguins also, just as an aside, are super awesome. They are really fantastic creatures. I take this to another place, which is that I think that the best place we have for guaranteed healthcare for a single payer system right now is probably coming out of the states at this point too. I think that we are most likely to see a California or a New York or Washington and Oregon move to guarantee healthcare and actually replace what they have at their state levels with a single payer system, which then can create regional ones. And actually, like the Colorado public option stuff like that could interact with a state level single payer. We have some federal stuff we have to work out for that. But like California alone, I think is the 5th largest economy right now. It jumped up a couple in the pandemic. Like California's population is large enough that it can easily provide healthcare. It's bigger than multiple countries who provide healthcare for their people. And like the unknown, the problem of it would be too many people moving into the state and you're like, that's not a problem. And California is like, that's not a problem. Texas is like, that's a problem. But that type of, that is when the federal system, federalized system, I think works, when the states are laboratories of democracy. The Senate is when the federalized system doesn't work, because then you have the Wyoming senator, blocking the California senators from the federal action that's needed. But I do think that we're in for a couple of interesting years where we're going to see this dynamic between the federal action and the state level action. Do you have any thoughts on what that might look like?
Well, I think you're right in that the state needs to be big enough and have enough income to do that, because I know Vermont tinkered around and then the math just didn't work. And Colorado also had looked at it, and at the time the math didn't work either. So I think you need a really big state, and you need an amenable federal government, because there's so many different payers in our healthcare system right now. If you can't capture enough of that money, the math just doesn't work. So you need to figure out what to do with TRICARE and the VA and Medicare and Medicaid and CHIP and private insurance and ACA and, all of it, figure out how all that works together.
You mush all of them together, and the first 2 you leave separate. VA and TRICARE are, you put those over here, you improve them, make sure that they are amazing. VA is a NHS system, it's a government system. So sorry, you didn't ask that as a question, but that is the answer. Everything after TRICARE and VA, you mush into one, but it's super complicated because you just named Medicare, which is a federal payer, Medicaid, which is split federal and state. And you have to figure out, well, if you're taking them, then the federal government, it's not like the state is just going to be on the hook for that. You need the federal government to give the money that they used to pay over to the state. So it's complicated, and you need that handshake ability, right? So like none of this would have been able to happen under President Trump, because that dude was terrible. And he danced he didn't know what tune he was dancing to, but the tune he was dancing to was big hospital, big insurance, big pharma. But keep going. Or maybe we could disagree on I think Colorado could have. It has the people. I don't remember what your population is, but it's a big state. I think you have the risk pool there for that's very possible. It was more that you have this weird referendum thing.
Oh, Tabor. Yes.
Tabor
is, and there have been changes to Colorado specifically that now even fees, like the way around Tabor was to make everything a fee instead of a tax. But now even fees have to go before the voters. So tell
everybody what Tabor is, because it is a bananas thing.
Yes.
It's sort of like it's like this reactionary. There's this really reactionary period in Colorado's history. And now it's not that, but they just buried this bomb in the state process that's really hard to deal around.
Well, Doug Bruce, who was a rich libertarian guy that eventually went to jail for tax evasion, I believe.
Oh,
Uh,
surprising.
hated taxes. And so he funded a ballot initiative that wrote into the Colorado Constitution that they can't raise taxes. If they wind up with more money in taxes, they have to rebate that back to the taxpayers. That means if your state is growing, which Colorado is, you've hamstrung all of your state government functions because they can never get enough money. It's putting your state in like a belt, and you keep tightening it, you keep ratcheting it up. So because of the pandemic last year, I think our revenue may have dropped. And so if that ratchets in, then we're stuck this year at last year's levels. And so it's pretty terrible. And there have been various attempts to try and change it. But part of Tabor is that it can only be altered by vote in an off year. So you can't, run a campaign to adjust it in an election year in which more people will voting. So it's always an anti-tax off year crowd that votes on these things. And so people keep coming up with ways to get around it or change it or whatever. There actually is a court case that is making its way to the Supreme Court on whether it is even constitutional.
It's obviously not constitutional. It's obviously not constitutional. Sorry, but that's the process is the hard part to get it overturned.
Right. But I mean, Colorado state legislators don't have the ability to do the job they are elected to do, which is pass a budget, raise revenue. And so that's the court challenge, and stay tuned to see what happens with the Supreme Court, because so far there has not been much luck in Colorado in overturning it directly here.
What the analog to that, and this is sort of far afield, but we like doing that on Solidarity Live. We get to go into the weeds, but it's good that we call it Tabor, because it's actually like the taxpayer something Bill of Rights, right? And it sounds good because they're good at that messaging, but it actually should be called the pathway to Mad Max and breaking your state forever. It's like you can Google all of this. They couldn't keep the streetlights on at a point because it was impossible for them to get revenue in until they figured out how to do it, which is just crazy. And then they wrote in that you couldn't get rid of it. And you're like, that piece is what's clearly unconstitutional. Like, the voters today can always change what the voters yesterday did. That the legislators today can always change what the legislators yesterday did. That's just, that's how our government is set up. The analog of that is the balanced budget amendment at the federal level. It's the same thing. It sounds like, oh yeah, balanced budget, just like my household. And you're like, that's not how it works. It should be called the Mad Max. Everything in shortage, get a chainsaw and a helmet, because you're going to have to battle your neighbors for, basic things. That is what I think kept Colorado from guaranteeing healthcare. And I do commend the public option folks for figuring out how to work it in a system that you have that detriment. Mm-hmm. But I also big time agree that you get a California in, it's got everything you need, and then you can attach Washington, Oregon, move Colorado. You have a huge risk pool then, and you have everything you need to provide healthcare.
And the way that the Colorado option works is that insurers are mandated to offer a cheaper plan. So it's not a true public option because it isn't a publicly owned and run insurance option, but they couldn't do that because of Tabor. You can't create this new government entity and take in fees and so on, because of all the budget implications of that. So again, this is another way in which Tabor is screwing Coloradans.
Yeah, that's what happens when you let libertarians do anything. Libertarians are just the mentality of 14-year-olds who like weed. That's it. That's all it is. They're
I
like,
think that is way too generous to libertarians because 14-year-olds who like weed can be kind of pleasant.
yeah, it's true. I'm just saying this one brand of them, right? Like they got high and they read Ayn Rand and they were like, this is amazing. Which, A, they probably didn't read it because those books are horrible. Like
They're pretty bad.
on a book level, they are terribly written. And then the philosophy that undermines them, you're like, oh, wow, you just did selfishness again. Oh, wow, that's really cool. That's an amazing accomplishment. Empowering humans to be selfish. That's a really big step forward, I guess.
Okay, but I'm sorry. Side note, that has nothing to do with healthcare. If you read The Fountainhead, not as great literature, but just as a hilariously bad romance novel, it's way better.
Yeah, you have, but like I didn't know we were going to do the Ayn Rand. Laura, have you read Ayn Rand before?
Thankfully not.
Oh man, Laura, you're in for an exciting time. Howard Rourke, rugged architect.
They literally, the writing is so bad that it is unbelievable. But then you remember QAnon happens, right? And you're like, okay, people. But the writing, they're like, all the heroes, they're like, he walked in the door and he was 6'5" tall and he had rippling muscles. I mean, it's literally like bad romance novel setups. And we have to deal with people whose political philosophy comes from these horrible novels that are so dumb that, like, it's annoying to me. And Ayn Rand also took Medicare and Social Security, and because she is a human being, her ideas, she didn't live by them. Because they're stupid. Because what would happen is Mad Max. Like that is what libertarianism is. But we have to literally deal with it when we fight for healthcare, because you've got like a Rand Paul who's a pretend libertarian. But these people are the plutocrats love this idea that government is the right? Like big government is the problem. Big business has so much control over people's lives. And it's the control over people's lives that's the problem. It's the lack of freedom and liberty and choice that's the problem. And whether it's delivered by whoever, like, it doesn't matter. That you're denied care is the problem in healthcare. Like, no one cares if the bureaucrat works for a mythical agency or a big business. If the bureaucrat's job is to deny care, that's the problem. If they work for the government, the bureaucrat's job is going to be to provide care. And so we sort of went far afield into the Ayn Randianism there. Bringing it back to what we might be able to get done now in this hand-in-glove state-federal system. What do you think about lowering the Medicare age? That seems to be that's a really hard policy, and it is vision, hearing, dental, out-of-pocket cap on traditional Medicare negotiation. I think that's not going to be easy, but I see all that. Lowering the age is quite difficult, and the federal public option is even more difficult. So, just sort of your analysis of where you see those last two in relation to the others.
Yeah, from everything I've heard and read, I think you're right. It's going to be a lot easier lift to expand Medicare to people that already get it than to lower the age. And my Senator Bennett, has put forth Medicare X, which is a Medicare buy-in public option type plan. And also, I don't think that's really gained a lot of traction. So just like what we've seen with the public option fights in the States, when you propose a public option, you're not only threatening the insurance companies, but all of the providers in pharma and everybody that makes a buck off the system as it is gets threatened by a cost containing system. So it's a lot harder than if you just pick one piece of the system, or expanding Medicare to cover vision, hearing, dental. That's more money in the system. That's not cutting costs at all. That doesn't threaten everybody. They like it.
It threatens it threatens private insurers, who I think are the weakest of the three in the evil triumvirate of big hospital, big insurance, and big pharma. Big hospital is possibly the most dangerous because they're huge, super powerful, and people don't know that they're evil. So like pharma is bigger and more money, but everyone knows that they're evil, and they don't even try to hide the evil, right? They're like, we're the good guys. And you're like, no, you're not. The hospitals are harder because people generally have like a feeling of goodness around them. They don't realize that the corporations behind it are the ones who are closing the hospitals, right? Like hospitals close in rural areas, not because the rural areas don't need the hospitals, but because they're not profitable to the corporations. Big hospitals, they just buy hospitals, close them down, and put as much care as possible into the ones that make the most money. And they don't like anything that provides care as a guarantee, like Medicare, because Medicare doesn't like to get ripped off as much. When it can, it says, no, we're not going to pay you that. We're going to pay you this. And the hospitals are like, that's unfair. We want to charge whatever we want to charge and keep it secret. That's the part that aspect of American healthcare has got to be the dumbest one of them all, right? Like, well, my doctor says I need this procedure. Exactly how much is it going to cost? And they're like, can't tell you. It's a secret. We'll send you a bill in like 6 months. It'll be for 25% of it. And then in like 8 months, you'll get the rest. And it could be between 0 and 1.5 million. Good luck, right? Like, what kind of system is that?
It's terrifying. It's a terrifying system. And it's, I think we've been discussing a lot, like the way it hurts people that are sick and the way, but I mean, you think about the perpetual anxiety that injects into the public sphere I think about this a lot. Like even young and healthy people who are insured and have nothing going wrong, what does it do to the collective consciousness when the idea of getting sick isn't the unpleasantness of getting sick, but the financial repercussions it could have? That's a terrifying thing for millions of people to live with.
And also people with chronic conditions of all ages. I mean, many people, when you're young, you're healthy, but that's certainly not true of everybody. And I mean, there are people that are born with diabetes or other conditions that will be deeply involved in the healthcare system for their entire life.
That's very true, Laura.
So Laura, it was a fun conversation. We went all over the place, and I enjoyed that. The Ayn Rand piece was, I think, the Tabor to Ayn Rand. But
they all have a very strong jawline. You guys just need to know about the jawline, okay?
They're very tall, rugged, and strong jawlines,
and a piercing stare.
And the like the bad guys in her books are just as, it's ludicrous. They're like short, with hunched and a stoop, and I mean, like, it's really horrible writing. But in the final minutes here, just signing off, Laura, instead of making it about how people can fight back against Ayn Rand, make it about how can people get involved, or what can people do if they want to get involved in this fight, this, I think, existential fight of what kind of nation are we going to live in? One where we let people get sick and die so that a few people can make ungodly amounts of money, or one where the people are guaranteed health care and the only losers are these billionaires. You are such a leader in this fight. How can people join in if they want to?
Well, to be the most effective, I think you need to pick the thing you want to fight about, because as we've talked about today, the healthcare system in our country is broken on so many levels and in so many different ways. So pick the thing that you're passionate about, whether it's prescription drugs or home and community-based services funding is in the infrastructure bill, or is it lowering the costs that you pay for insurance through making the American Rescue Plan subsidies for the ACA permanent, or is it reform on your state level? So figure out what thing you really care about and how to make a difference there. And there are all kinds of different organizations that are focused on all these things. You know, if you want to lower the cost of prescription drugs, there's Patients for Affordable Drugs is working on that. Social Security Works is working on that. The Lower Drug Prices Now Coalition, Protect Our Care is working on drug prices. I'm doing work across a bunch of these issues with Healthcare Voices at healthcarevoices.org. But also, if you are interested in just about any type of issue, right now, the infrastructure plans have so much healthcare related stuff in them. You will certainly be able to find a group that's working on the thing you care about, and you can get active now to make it happen, because the next couple months are going to be critical one way or another.
Laura Packard, thank you so much for joining us today on Solidarity Live. And you heard it from her, what we always say, find what drives you, find your people, get organized. And then when we raise our voices together, we never lose. Thank you so much, Laura.
Thank you.
What do you think, Jocelyn?
I think we should write our own version of Ayn Rand novels with our vast amounts of free time.
It would be pretty easy, though. Also, the thing is, what you got to do is just write a crappy novel that's like this big, because you know none of those people, they didn't
like
read it.
800 pages.
They're like, it's a bunch of people who are like, wait, I can be selfish and mean to people, and that's a good thing. They're
And
like,
that's hot.
I'm
You guys
into
are
that.
into that?
All right. I am really happy that the Supreme Court ruled the way they did. It's wonderful when millions of people don't lose their health care.
Yes.
And 11 years in, like there's a, politics and process and all of these, there's all these things. But at the end of the day as well, it's really just like, after 11 years, it's sort of baked in a way that the courts are like, we're not going to upend this whole system. And that's useful. It's useful to me because I fought really hard for Obamacare. We lost on the public option, but the Medicaid expansions are some of the best things that I've worked on. But I think we need to move beyond Obamacare. We need to move to the next fights. We need to get to single payer Medicare for all. We need to guarantee healthcare for every person in this country as a right. And that, I think, the Supreme Court, the SCOTUS ruling, will allow us a little bit of room to do that. I think actually some of the groups that were really working on protecting Obamacare are going to be shifting over to fighting to get Medicare to negotiate drug prices and expanding some benefits. So I don't know, do you want to sign us off on this lovely Monday morning?
Yeah, this was great. It was really, Laura is wonderful, and it is very, like so many fights that we're in right now, it's the people that have made these advances and done all this organizing are just modern heroes. And, everyone needs to get involved and stay involved, because like a lot of these fights, the side of history, we're on the right one. And wait, I'm sorry, what was that? If there was like a word for all of us working together, could you help me out here?
It's not coming. I don't know what you're...
It's like if we all do things together, we're more powerful.
Solidarity.
Oh my God, I forgot.
Thank you. It is.
Awesome. Well, it was so great to see you guys. And this means we get to talk twice this week, right? I
think so, yeah. I think that's right. So we'll see you again on Friday.
Awesome. Bye.